Welcome to Coffee and Conversation AI in Healthcare. I'm Jen Hand from Informatica, and we are here today with Nigel Ohrenstein. Welcome, Nigel.
Thank you. Happy to be here, Jennifer.
So you've dedicated almost 20 years or more to helping change the face of healthcare. And as the co-founder of Lumeris, you've built the organization into a leading value-based care company, which we will dive into. But first, you've served as the president of Kaya Health for 2 years and recently have moved into the president role at Teletracking. So this is an impressive resume, and I'm super looking forward to picking your brain as a trailblazer in some of the unique areas of digital health and AI. So let's start with your work at Teletracking. So this is a relatively new role for you, and I know that one of your big passions is access to care. So can you share a little bit more about teletracking and how AI plays a role in patient access to quality care?
Sure, happy to. So thanks first of all for having me on. Delighted to chat to you. So Teletracking is a really interesting company that is in the business of helping hospital systems become more efficient, drive patient flow. Perhaps the simplest example is as soon as the bed becomes empty, telesystem systems are the ones that send an alert to the cleaning crew to clean it, and then an alert back to admissions as how to do it. When you think about that as sort of one hospital, that's sort of where they started. Today they built a big business over 250 hospitals in the US, and also the NHS in England, and also we've got clients in Germany that rely on Teletracking's system. But when you now think about how you can connect not just healthcare systems, so you can have multiple hospitals in a system, but we've expanded beyond that into sort of the broader network as healthcare has moved out into the both into the home and into the community, and teletracking is connecting all those different pieces of the healthcare system. So the best way to think about it is sort of like the FedEx of healthcare, right? We're tracking assets. By what we mean by that, like, could be pumps, could be thermometers, could be people in the hospital. When you put that little wristband on and you walk in, that's there to help keep you safe. Where are you in the hospital? Track you into the emergency room, into operating out, right? And so Tele's providing that system that both drives safety, efficiency, but also enormous clinical opportunities. So if you think about the data that is captured, and then the ability to use AI to both now predict certain types of healthcare events, but also to drive information that helps people, particularly nurses and other clinicians, make proactive decisions as to where people should be admitted, or what type of facility they should be in, what interventions are going to be important. And so to be honest, I hadn't heard of Tele before they reached out to me, but it's such a critical company because the hospital systems in this country and abroad are literally on fire. It's a massive crisis that is affecting US healthcare, and we can't exist without healthy hospitals, not just in big cities like Denver or New York or somewhere else, but also out into rural communities. So to me, this is not just about a mission that's really important. It's more important that it's sort of mission critical that Tele does the work that it's doing. And so as we continue to evolve, we'll integrate more and more AI into the platform to help drive those clinical interventions, and the ability to do that and the capability to really impact both clinical efficiency and clinical care is sort of limitless. And so it's exciting times for us as a company, and I think exciting times for healthcare systems as we continue to build out our suite of products.
That analogy is great, the FedEx analogy, because you can immediately place exactly what you do in the context of something that everybody knows. And I know it's been around for quite some time. I think I read 32 years. So has AI always been a component in the platform of teletracking, or is it a relatively new integration into the company?
Yeah, so data has always been critically important, and analysis of that data has always been an integral part of the platform. But the advances we've had more recently in machine learning and artificial intelligence, and the ability to bring those into sort of the sort of quote unquote common world, has become much easier. And part of that is not that the technology itself is new, right? Machine learning's been around for a while and AI's been around for a while, but part of that is the acceptance of the user. And so, you know, for those of us who've been in healthcare for a long time, you can you know, win a contract, implement software, but then adoption is a whole different ballgame, right? And getting people to actually use it is hard. And one of the reasons it's so hard is because that involves behavior change, and people don't like changing their behavior. And so healthcare, I would say, has been, and not just healthcare, but other industries, but particularly healthcare, has been less receptive to predictive information, um, because people say, hey, how can, you know, they get worried about the potential downsides of a computer making care decisions and things like that. And right. And so we're definitely not in the business of making care decisions, but we are in the business of how do we present caregivers and clinicians with the data that helps them make informed decisions. And so if we can identify that there's a risk here, and hopefully they can then act on it, that's where sort of the power. And I think, you know, it's really only been with the advent of ChatGPT that people are getting much more comfortable that actually AI can be really helpful to me. It doesn't have to make my decision for me, but it can be really helpful to me.
I like that you brought up the adoption piece, because AI has been in our world for a while, but when you're talking about what you're saying, changing your habits or learning a new tool, or the fear that it could make your life harder at first, that big learning curve, I think it is crucial in healthcare, because frontline staff are busy, people are burnt out, and so to have one more thing to do. So I like bringing that into the conversation, that it has been here for a while. It's just that the adoption is now finally happening, and sort of we're moving into that tipping point of it just becoming normal, of it just becoming, it's not, oh, AI, it just is how we operate. So it's interesting, because I think your company it's a unique area in relation to AI in healthcare, because typically when people think of AI in healthcare, we often think of like virtual assistants, chatbots, clinical documentation, and things of that sort. But AI strengthening quality of care is an area that has a huge opportunity for growth. So this is a little bit speculative, but that's why we have these series, so we can ask these kinds of questions. But if you could look 10 years into the future, how do you see AI continuing to evolve the area of quality of care?
Yeah, sure. Uh, we have enormous potential and opportunities, obviously, in front of us. Anybody who's spent enough time in the US healthcare system or other healthcare systems around the world know that there are no shortage of opportunities to how we can improve the quality of care. And I think it starts with, as you know, back to that behavior change, it starts with a recognition that we can do better, that there are opportunities to do better. Often we have this belief that we've built it best ourselves, right? Or you know, we know how to take care of patients. You know, don't tell us how to take care of patients. But really, the analogy that I often use is back. I was back home in England visiting my parents, and we were going to a family wedding, and my dad and my mum said, "Hey, we're taking pictures before, you know, don't be late." And they left probably about an hour before I did, and I was still sitting on the couch watching a game of soccer. And um, as I was pulling into the place and then walking out of my car and crossing the street into the hotel venue, my parents pulled around the corner, and they'd just arrived, having left an hour earlier. And I said to my dad, I said, jokingly, I said, I guess you took the scenic route. And the moral of the story is my dad knows the back of London and knows London like the back of his hand, right? Knows multiple routes, knows everything, but sort of refuses to use Waze because he knows it pretty well, right? Well, I knew how to drive there, but I also knew that Waze will give me real-time information that will impact my decisions at sort of quote unquote the point of care. And that's sort of the struggle I think we have in the healthcare system today, right? Is that people think they've worked in the healthcare system for many years, they know how to do the procedures they're doing or take care of patients the way they've always been taking care of patients. And now we have the ability to deliver real-time information, right, through the equivalent of Waze, right, which is sort of like the teletracking platform that can impact the care. And so over the next 10 years, I think that we'll be significantly more sophisticated in how we think about both adopting AI, integrating into the system. And again, I want to reiterate, it's not about making the care decision for the clinician, right? That's ultimately the clinician's job. But we can do what we can do is provide them with data and information that gives them insights that they may not previously have had. In this scenario, that person has more likely to have a readmission, right? And so now we can say, hey, follow up with that patient proactively within the first 5 days, because based on all of the data we have, there's a greater likelihood that this patient with this profile and this demographic will have a readmission in the next 30 days. That's not telling them how to deliver care or what to do, but it's giving them insights that enable them to make better decisions. Teletracking can tell a hospital system where they need to flex beds, right? Where do they need more beds? Where do they need less? What time of year? Where should they invest? Where are they seeing more capacity? What capacity levels do they need? And so there's all this information that ultimately will enable people to manage a more efficient system and ultimately make better care decisions. And so the beneficiaries in the end are patients who should get better healthcare as a result. So I see it becoming, 10 years is obviously a long way out, but I see it being both ubiquitous in the way that we access and look at information as patients. We'll have much more greater visibility to information than we have today, but also how the information we put in front of hospital operators, clinicians, other people in the healthcare sector to make more informed decisions, basically using Waze and like I did, as opposed to ignoring it because you know better, because that's the way you've always done it.
And I think with a topic like quality of care, there's sometimes a barrier of, we think if we introduce AI into that area, we lose the human touch, we lose empathy, we lose that connection, clinician to patient. And it's interesting what you're saying, that AI has its place in data, in numbers, in operational efficiencies and things like that, to enable clinicians, frontline staff to almost operate at the top of their game and at the top of their license. So it's like almost letting go of this, the fear or the barrier that AI is just going to take over as a sort of non-human entity versus it complements all these things. So I think that's a great point to bring.
I don't see that ever happening, because we all know that medicine performed at its highest level is much more of an art than a science, right? We intuitively can tell when we see a really good doctor who's taking into consideration so many facts, right? Not just their history and their training and their experience, but sort of your social economic environment, what's going on in your life, all these other things, right? And they almost have, the best doctors almost have a sixth sense as to how to treat and what to treat. And so it's impossible in my mind, to see that ever being taken away. But I do see us, as patients get more comfortable with it, more routine things, we're going to be more comfortable with it. Take something that exists outside of this country, but is not sort of abhorred in America, right? Which is sort of a strep throat test, right? In other parts of the world, there's an over-the-counter strep throat test that you can take and people keep at home, obviously, because when you've got multiple kids and you've got a sick kid and now you've got to take them to the doctor to get a strep throat test, and you can do it, right? So that's AI, but it's an example of how we might accept certain things as being more things that we'll accept sort of an AI interaction for, because we'll recognize the value of it, the speed, the quality of it. And then there are things that obviously, as you get more complicated and have more comorbidities, AI will never replace, in my opinion, will never replace the skill of a top clinician.
Yeah, the supplementation of using AI as to enable that best care of practice. So I want to end
it's
with
no different in some ways, and it's no different to all the different tools that we've utilized over time, right? Microsoft Word, Google Docs, right? They didn't exist, right? It doesn't make somebody a great writer because they've now got Microsoft Word, right? It's just a tool that enables them to convey their ideas, which is much easier than it was previously.
yes,
Right.
And as humans, we like convenience. So
right. Yeah.
So I want to make sure I pick your brain for just a minute about your work at Lumeris. So you co-founded the company and were there for 12 years, transforming the company literally from the ground up. So it's interesting because Lumeris helps health systems and medical groups transition to value-based care. So that's an area where AI has massive potential. And I know there's industry talk about AI helping to improve clinical outcomes, lower cost of care, and all that kind of stuff. But for you and your work in Lumeris, what is the area, if you could pick one, where you found AI to be the most transformative in your time there?
I would say that one of the things that was fabulous about Lumeris is it was built on the real life practice of phenomenal clinicians, right? That really understood how to take care of populations. And so I think what we set out to do was, how do we bottle up that clinical excellence and enable other people in other parts of the country to sort of take advantage of it and to benefit from it. So I would say overwhelmingly it was giving access to proactive information that help clinicians act in a different way. And so the platform that Lumeris built and exists still today is foundational for certain clinicians, Lumeris clients, to manage populations at risk. And the analogy that I often used to use when I was at Lumeris is, if you walk into a cafeteria today and they said, hey, these are all your patients, take care of them, right? Historically, you would have just sat at the counter and waited for people to come to you as and when they had something that they wanted to take care of, sort of quote unquote the cafeteria model, right? They would just show up and buy something. And what Lumeris did was help identify, how do you prioritize these patients, right? How do I, if I've got 300 to take care of, who are the most important ones that I need to see, and why, and what are visibility sort of to their comorbidities, to the drugs they were taking, to all that information that is, that goes far beyond the EMRs. The EMRs, unfortunately, have hindered the growth of and the development of healthcare in our country. And they're closed systems, they don't integrate well, they try and shut out competition, and in effect what they've done is build nice companies for themselves and good revenue for them and their shareholders, but they've made it so much harder for healthcare to evolve in this country, and to reach sort of the levels that it had. And so it takes companies like Lumeris and others, Teletracking, to have to come in and fill the gaps, right, that are sort of glaringly there. And so another fabulous analogy as I think about teletracking is there's many people don't know it, but there's a company, I think it's called SIBA, that sort of created the sort of automated the all the travel information. So when you go onto Expedia and when you go to American Airlines or any of these others, right? This was the company that sort of built the network. And so the best way as I think about teletracking is that we're that network, and then we're agnostic to EMR, right? And so that to me is how we sort of enable companies like Lumeris and Teletracking and others to really make giant strides forward in utilizing AI to drive better cost and quality of care by creating these networks that are agnostic and not these closed networks.
So it sounds like you've found your niche as far as AI in healthcare and the sector of access to care, quality of care, which is amazing because it's an area that has seen so much transformation in the last 10 to 15 years and needs it as well, and has needed it. So I just want to thank you so much for sharing your diverse background with us, for sharing your thoughts with us, and we can't wait to see how well you do at teletracking and how you're continuing to change the face of healthcare. So thank you.
Thank you. Appreciate you inviting me on. Enjoyed it.